Have you ever taken the famous weekend pill, expecting a movie star performance, only to end up with a headache and huge frustration when it mattered most? Believe me, this happens to thousands of men, not because the medication is bad, but because the way it's being used is completely wrong and lacks medical strategy. Tadalafil is a potent tool, but it requires a biological instruction manual that few people know about, and ignoring these details turns an effective treatment into a Russian roulette of anxiety. In this video, I'm going to hand you the blueprint. These are 5 practical, science-backed adjustments that supercharge the action of this drug in your body. If you want to ensure the medication delivers 100% of what it promises, with safety and maximum rigidity, you need to apply these corrections to your routine today. Pay close attention, because the third adjustment is usually the game changer for those looking for spontaneity and who want to stop scheduling sex. To start, we need to align the basics. Tadalafil is a PDE5 enzyme inhibitor, which means it facilitates the dilation of blood vessels in the penis, but it does not create an erection from scratch. It works like a road facilitator. If there's no car passing through, which is your desire and stimulation, the open road is useless. The medicine keeps nitric oxide available for longer in the penile tissue, allowing blood to enter forcefully when you are stimulated, not magically while you are reading a book or watching TV. The biggest initial mistake is thinking the pill is an aphrodisiac that will increase your libido or desire to have sex, which biologically isn't true. Understanding that it acts on the hydraulics and not on the will is the first step to taking the weight of performance off your shoulders and letting the medication work on the physical part while you take care of the mental part. Now that you understand the basic mechanics, let's go to the first practical adjustment involving the clock and patience. If you want access to medical information that actually works, without myths, hit the like button and check your subscription to the channel so you don't miss any new content on men's health. Unlike other stimulants that have a rapid action, Tadalafil has a plasma action peak that takes about 2 hours to reach maximum levels in your blood. Many men take the pill 15 minutes before sex and get frustrated because the erection doesn't come with the expected rigidity at that exact moment. The first proven adjustment is anticipation. If you use the 20 milligrams on-demand version, the ideal is to take it well in advance, ensuring the drug is already circulating in high concentration when the moment arrives. The great advantage of this molecule is its long half-life, which can last up to 36 hours in the body, earning it the nickname the weekend pill. This means you don't need to and shouldn't take it at the last minute. Taking it in the afternoon for sex at night is a much smarter and safer strategy. However, even taking it at the right time, there is something you put in your mouth that can completely block the absorption of the medicine, and that's what we'll talk about now. Although Tadalafil suffers less interference from food than sildenafil, Viagra, very heavy and high-fat meals can indeed delay absorption and the onset of the effect. The second adjustment is to avoid that heavy stew or greasy barbecue immediately before taking the medication, because blood diverted for heavy digestion competes with the need for flow in the pelvic region. The ideal is to keep meals light in the hours leading up to use to ensure the drug enters the bloodstream without obstacles. Another critical point is alcohol. In small doses, it disinhibits, but in excess, it is a central nervous system depressant and worsens erection quality, fighting directly against the effect of the medicine. Many men mix the pill with high doses of alcohol to gain courage and end up nullifying the vasodilator effect, resulting in failure. But if you want to get rid of this worry about food and the right time, there is a form of use that changes the game, which is our third and most important adjustment. The third adjustment is switching from on-demand use, 20 milligrams, to daily low-dose use, 5 milligrams, which creates a stable state of the medication in your blood. By taking 5 milligrams every day, you eliminate the anxiety of having to perform at that specific time and recover spontaneity, as your body will always be ready to respond to stimulation. This corrects the side effect peak, as the body adapts better to constant low doses than to a 20 milligrams bomb every once in a while. This strategy also chronically improves pelvic circulation and helps with urinary symptoms caused by prostate growth, killing 2 birds with 1 stone. For many patients, this transition is the secret to forgetting they take medicine and returning to a natural sex life, where the erection simply happens. However, for this magic to occur, your body's engine needs to have its oil checked, and this is where the fourth hormonal adjustment comes in. Value content like this deserves to be shared, so send this video to a friend who needs to know this and subscribe now to master your health and performance. It's no use having clear roads, vasodilation, if you have no fuel in the tank, and the fuel of the male erection is called testosterone. If your hormonal levels are too low, hypogonadism, Tadalafil will have a very poor or null effect because the central chemical command to start the erectile process is missing. The fourth proven adjustment is to check your testosterone levels before blaming the medication for the failure, as often the problem is metabolic and not vascular. Correcting testosterone levels, when indicated by a doctor, works in synergy with Tadalafil, absurdly boosting the final result. It is common for us to receive patients who think the medicine has stopped working, when in fact testosterone has dropped due to age, stress, or obesity. Adjusting the hormone restores libido and the integrity of penile tissues, making the medication work again with full force. But remember, even with hormones and medicine, without the next adjustment, nothing happens. The fifth adjustment is behavioral. You need visual, tactile, and mental stimulation for the cascade of erection events to begin. Many men take the medicine and sit on the couch waiting for the erection to appear, or go into sex with a head full of problems and bills to pay. Anxiety releases adrenaline, which is a potent vasoconstrictor, and closes the vessels that Tadalafil is trying to open, nullifying the chemical effect of the pill. For the medication to work at its maximum, you need to surrender to the moment, focus on the sensations, and allow sexual stimulation to activate the pelvic nerves. The adjustment here is to create a conducive environment, adequate foreplay, and connection with your partner, ensuring the brain sends the signal to open the floodgates. Now, of course, the use of this medication can bring some discomforts, and knowing how to deal with them is essential so you don't give up on the treatment. It is very common that, by dilating the vessels of the penis, Tadalafil also dilates vessels elsewhere, causing headache, facial flushing, heartburn, or a stuffy nose. Many men abandon treatment because of this, but there are simple adjustments. Keeping yourself very well hydrated helps minimize the headache, and these effects tend to diminish with continuous use of the daily 5 milligrams dose. The body usually builds tolerance to side effects after the first weeks of regular use. Another important tip is to avoid taking the medication on a completely empty stomach if you suffer from heartburn, reflux, or use simple medications for headaches if they appear, provided there is no contraindication. Fear of side effects often generates more anxiety, so knowing that they are temporary and benign most of the time brings peace of mind. However, there is a risk group that needs a total red alert, and ignoring this can be fatal. To continue receiving guidelines that protect your health and improve your life, leave your like here and ensure your subscription to the channel. Tadalafil is a safe medication for the heart of the vast majority of men, even helping with endothelial function, the vessel walls, but there is an absolute contraindication: concomitant use with nitrates. Men who use medicines for angina or chest pain based on nitrates, such as isosorbide or nitroglycerin, can never use Tadalafil, as the combination causes a very severe and dangerous drop in blood pressure. This is the point where self-medication becomes a real life-threatening risk. Furthermore, patients with severe heart failure or who have had a heart attack very recently need a cardiological evaluation before starting vigorous sexual activity, regardless of the medicine. The adjustment here is responsibility. Never take a pill from a friend without knowing if you have compatible heart conditions. Safety always comes first, and it is what guarantees that you will be able to enjoy the benefits for many years. Tadalafil can be the key to rescuing your sex life, provided it is used with intelligence, strategy, and supervision. Applying these 5 adjustments, getting the timing right, watching your diet, considering daily use, checking testosterone, and ensuring adequate stimulation turns a frustrating experience into absolute success. Do not treat this medication as a magic pill, but rather as a tool that needs a skilled operator and a well-cared-for body to work. Recovering virility is fully possible and within your reach. Just get out of the amateurism of self-medication and seek the fine-tuning your organism needs. If you want the machine to work, take care of all the gears. Tell me here in the comments, which of these adjustments did you not know about or were you doing wrong? I want to see your answer, and don't forget to subscribe for our next meeting.